Hello, my name is Dr. Pinkal Desai, and I'm going to talk briefly about our abstract clinical predictors of outcomes in adult patients with acute leukemia and myelodysplastic syndrome and COVID-19 infection. I present this on behalf of the ASH Research Collaborative COVID-19 Registry and my co-authors. COVID-19 infection has been associated with the increased mortality in patients who have advanced stage and cytopenia at diagnosis in normal populations. Because patients with acute leukemia and MDS are generally older and have disease or treatment-related cytopenias, this might impact the severity and mortality from COVID-19. We wanted to understand the predictors of outcomes from COVID-19 infection in AML, ALL, and MDS, which are currently lacking. We used the ASH COVID-19 Registry for Hematology in order to answer this question. The primary outcome was mortality from COVID-19. Secondary outcome was COVID-19 severity. We had a total of about 257 patients in our cohort that had the diagnosis of AML, MDS, or ALL, and had a diagnosis of COVID-19 infection as ascertained by their doctors. These patients were equally sort of older than 60 as well as less than 60, had multiple comorbidities. A lot of these patients had the diagnosis of acute myeloid leukemia. 46% were in remission and 44% had active disease at the time of COVID-19 diagnosis. In a multivariable analysis of severe COVID, which was defined as ICU admission because of COVID-19 related reason, neutropenia at diagnosis and having active disease status were both independently associated with severe COVID. As seen here, among patients who had severe COVID, 67% of those had active disease, while only 33 were in remission. With regards to mortality among patients who were hospitalized for COVID-19, we looked at several risk factors, including age, neutropenia, disease status, comorbidities, type of heme malignancy. But the only two variables that were significantly associated with COVID-19 mortality was having an estimated pre-COVID-19 prognosis from the primary disease as less than 6 months, and also ICU deferral when this was recommended to patients. Overall, the mortality in the cohort was 21%. Mortality among hospitalized patients was 34%, and mortality among patients who went to ICU was 68%. We concluded that mortality in patients with AML, ALL, and MDS was higher than what was expected out of non-cancer populations, that neutropenia at diagnosis as well as active disease was significantly associated with higher COVID-19 severity. Active disease was not associated with increased mortality after admission into the hospital, however, and the two factors that did impact COVID-19 related mortality was having a primary disease prognosis of less than 6 months and deferral of ICU. We conclude that if desired by patients, aggressive support for hospitalized patients with COVID-19 is appropriate, regardless of remission status, given the results of our study. Thank you.